Conversations for Change, the 5 A's and tobacco cessation. This video is produced by the Behavioral Health and Wellness Program in the School of Medicine at the University of Colorado Anschutz Medical Campus, with funding support from the Smoking Cessation Leadership Center, SCLC. This video demonstrates the 5 A's, a brief, evidence-based intervention which allows healthcare workers to talk with patients about tobacco cessation efficiently and effectively. Tobacco dependence and use is a chronic relapsing condition that requires repeated interventions and a systematic approach. The 5 A's are ask, advise, assess, assist, and arrange. In this video, you will follow a provider as she works with a patient to stop smoking. The first A is to ask about tobacco use. The goal is to ask about the patient's current tobacco use and explore their tobacco use history. Asking about past quit attempts can help to identify what did and didn't work in previous quit attempts. This information gives the healthcare provider what they need to help a patient to quit. Let's see what this looks like in action.
Hello, Darian. How are you today?
Fine, thank you. How are you?
I'm well, thanks. Before we get started, I just wanted to check in with you about a few things. Is that okay with you?
Yes.
So I see from your chart that you are currently using tobacco. What can you tell me about your tobacco use?
I'm down to about a pack a day now. I started cutting back ever since my sister died of cancer last year. She smoked for 30 years, and the doctor said she would have lived longer if she didn't smoke. I smoked for almost that long, and I'm scared about what it's doing to my health.
30 years is a long time. You say you've smoked almost that long? How long have you been a smoker?
About 28 years now.
Wow. So you were a young man when you started. Why did you start smoking?
Oh, it was the cool thing to do. If you didn't smoke, you weren't tough. And in my neighborhood, if you weren't tough, well, that was a problem for you. So I just started smoking just like everyone else I knew.
Well, it sounds like you're aware of some of the negative health consequences from using tobacco, but what is it you're scared of?
Well, my sister died of throat cancer, and my parents died of tobacco use too. My father had a heart attack, and my mother had lung cancer. I just don't want to suffer like they did.
And that sounds very scary.
And with my kids growing up, I don't want them to end up in the same boat.
And you want to be a good role model for your children.
I do. I don't smoke in the house because I don't want them exposed to it. But they know that good old dad smokes. They tell me to quit all the time. In fact, my daughter made a poster about the negative effects of tobacco use for school, and she made sure to show it to me before she turned it in.
And have you ever tried quitting smoking?
Yeah, I went a whole summer once without smoking. Then I started again when the kids went back to school. I used a patch that time, but I didn't like it. It gave me weird dreams and made my skin itchy.
Some forms of nicotine replacement therapy work better for different people. Aside from the patch, have you tried anything else?
Yeah, I've gone quite a while just going cold turkey. Mostly after my kids were born. I went a couple of months both times. But then something happened to stress me out enough to where I just went back to it.
As you can see, just by asking Darian about his tobacco use, we gained some valuable information. We learned that he is currently smoking a pack a day. He has smoked for a long time. He is scared about possible health consequences, and that he has had some success with quitting in the past. Notice that the healthcare provider gently guided him to share more information without being negative or judgmental. This likely helped Darian to open up about his tobacco use. The healthcare worker now has a lot of information that will help her create an effective quit plan specific to his situation. Now, let's move to advise. The second A is to advise. People who use tobacco should be strongly advised to quit in a way that is positive, supportive, clear, and personalized. Be sure to express concern for the person's well-being, letting them know that you are committed to helping them quit when they are ready. Research shows that when healthcare providers advise patients to quit, patients are up to twice as likely to quit for more than 5 months than patients who were not advised to quit.
Well, it sounds like you've had some success with quitting in the past.
Yeah, I guess so.
Well, stopping smoking is the single best thing you can do to improve your health. And as your healthcare provider, I strongly recommend it, especially in light of your sister's recent death.
Yeah, I hear you.
Here, we see the healthcare worker advising Darian to quit in a strong, clear, and personalized manner. Even though her message was strong, she did so in a way that allowed the patient to hear her concern. Now let's move to the third A, assess. When assessing a patient, you'll want to explore their readiness to change. To do so, it's helpful to find out whether they're ready to make a quit attempt. One quick, effective way to do this is to use a change ruler. When using a change ruler, begin by asking the patient to rate themselves on a scale of 1 to 10, with 1 being not at all ready to quit using tobacco, and 10 being ready to stop using tobacco right now. Once the patient has rated themselves, it is helpful to discuss why they chose this particular rating instead of a lower number. This way, we can learn why a patient wants to quit, as well as the barriers that may stand in their way. Also, assessing the patient's level of nicotine dependence will help healthcare workers refer patients to the resources that meet their needs. Let's see what assessing looks like with Darian.
I know that I want to quit, but I'm just so scared. I failed last time, and if I fail again, I think I might just give up. Plus, it's just so hard to quit. But I know I'm only hurting myself by continuing to smoke.
So, on one hand, it sounds like you're scared to quit because you don't know if you can do it. And on the other hand, you're aware of the negative health consequences and want to quit so you can live a longer and healthier life. Is that right?
Yeah, it's just so hard.
So it sounds like your previous experience is acting as a barrier to your quitting right now.
Yeah, I don't want to fail again, you know?
Well, quitting smoking can be hard. In order to get a better sense of your readiness, let's talk about a scale. So on a scale of 1 to 10, with 1 being not ready and 10 being very ready to quit smoking, where would you put yourself?
Well, I know that I want to quit. I'm just not sure that I can. So I guess I would put myself at about a 6 on that scale.
Oh, okay, great, a 6. So why are you at a 6 and not at a 4?
Well, I know that I want to quit. If I said that I was a 4, then I would just be saying that I want to quit without doing anything about it. And my kids, if they started smoking, I don't even think I could tell them to stop because I smoke. And I don't want them out there thinking that that's okay.
Yeah, that makes a lot of sense. So tell me, what would need to change in your life in order to get you to an 8?
Well, an 8 would be great. I guess I would have to start thinking about quitting. Coming up with a plan that would work for me. I would want the support of my family and friends, and I would tell them about the plan and ask them to put up with me for about a week or so. And I would really want to learn about the medications that are available to me, so I don't have to use that awful patch.
Okay, so you can pretty easily identify supports and actions you can take to move yourself to an 8 on this scale.
Yeah, I guess so. I mean, I would want to quit, and I would be able to start by making some of these changes.
As you can see, when assessing a patient, it is important to reflect change statements so that you can check understanding and summarize the patient's ambivalence. The fourth A is to assist patients to make a plan for change. Every individual will have different quit plans and goals. If the patient is ready to quit, make the message personal and specific to each person's situation. Listen to their story and let them know about their options. Healthcare workers can talk about setting a quit date or gradually cutting down, depending on the specific needs of the patient. It can be helpful to explore the pros and cons of both options so they may make an informed decision. You should also explore potential barriers to quitting, such as concerns about withdrawal symptoms and weight gain. Finally, encourage individuals to talk with friends and family about their desire to quit so they can get the support they need. Let's watch how this healthcare worker assists Darian.
Absolutely. I'd be happy to talk with you about nicotine replacement therapy today, as well as some behavioral supports that we offer. We can also spend some time talking about how to ask family and friends for support through this process. How does that sound to you?
Sounds great.
Here, the healthcare worker assists Darian to access resources that will be helpful in his quit attempt. She helps him by sharing information about nicotine replacement therapies, as well as going through some scenarios that may assist him in speaking with his loved ones about his upcoming changes. The fifth and final A is to arrange. Once the patient and healthcare worker have decided on a plan, it is important to arrange a follow-up meeting to check in on their progress. Tobacco users who have follow-up appointments are much more likely to quit or sustain their quit attempt. Some healthcare workers may have more time to spend with patients and therefore have the ability to work more closely with them around tobacco cessation, while others only have a few minutes to spend with each patient. Regardless, setting up follow-up appointments is an effective way to help patients with this change. Healthcare workers should continue to talk with patients about potential barriers to quitting or staying tobacco-free. It is important to congratulate all successes, even small ones. Changes like reduction in daily use or avoiding smoking in difficult situations are reasons to celebrate.
Okay, let's meet again in 2 weeks and we can talk further about your readiness to stop smoking. That'll give you some time to think about medication options and talk with family and friends. And at that time, maybe we can talk about your next steps.
Yeah, we'll have to see. I mean, it's still scary to think about quitting, but I can definitely talk to my family and think about the medications that'll work best for me.
Okay, great. Well, if you have any questions in the meantime, please feel free to give me a call.
See you in 2 weeks.
All right.
As we can see, the healthcare worker arranges a follow-up meeting with Darian to discuss his progress. It is important to note that she did not just say, "Come back in 2 weeks," and leave it at that. Instead, she provided some guidance about next steps based on their conversation that can help to increase his readiness to quit. In this video, you have seen a healthcare worker use the 5 A's to work with a patient around his tobacco use. The healthcare worker asked him about his use, advised him to quit, assessed him by exploring his readiness to quit, assisted him in creating a plan to address his tobacco use, and arranged a follow-up meeting to talk about his progress. The 5 A's are a quick, effective way to address tobacco use with patients.